Hello, everyone. It's Jessica Martin here with Martin Dental. I am here to talk with you today about some updates that we have at our office and kind of let you know what we've been up to while we were closed as well. So, if you followed us along during our closure, you know that Tony was working on making N95 equivalent masks with our 3D printer. So, we certainly spent a lot of time in the early part of quarantine doing that. We also spent a lot of time doing some CE, getting our team rallied around infection control procedures and how things would change when we did reopen. So that was quite an undertaking, and you'll notice a lot of those changes when you do come to the office next, and I'll talk about some of those here as well. And then we spent a lot of time rescheduling and communicating with patients, trying to just keep things as smooth as possible for our patients during that time. We did some work in cleaning up our database and activating old patients and just kind of cleaning things up on the back end. We updated our operations manual, which if you've ever done that, it's not very fun, but really is helpful when you have new people come on board and you're training and things. So that was great. And then Tony did some virtual consultation training, and now we're implementing that. So anyone that you know that's interested in getting some dental advice about something that they want to do with their teeth, or whether it's Botox or something like that, but maybe can't get an appointment right away or doesn't want to come in for an appointment quite yet, we can do that virtually right off our website. So that's pretty great. And then things that we are still working on that we started during quarantine, we're working on getting some medical billing going in our office. And so that is a huge undertaking, but it's going to be a great value for our patients once we have it up and running. So stay tuned on that. And then we are also working on a membership program for patients. And again, this is one of those things that might come out in another year or so, because it is another undertaking. So those are things that are in progress. And then I included some fun pictures. The top photo there is our daughter's COVID learning station. We just set up a little table in our kitchen, and that's where she's been doing her homeschooling. And on the bottom there, the kids did go on the lake a couple times already, even though it was against my wishes. They wanted to do it, and they said it was okay, even though it looked really cold to me. And then we've just been having a lot of family time, of course, during when we were closed. We're open now, of course, but a lot more time with the kids, which was really great. You can see we're doing some sparklers there at the bottom, and then the couch full of the babies. Our daughter has just fallen in love with having dolls again, even though she's had them this whole time. She's sort of been re-inspired during her time off from school. So that's all of her babies laid out on the couch, and you probably can't see it, but our dog is in there too. And it's kind of like the ET where the dog's face is hiding. You can't really see it because she's tiny, but she's laying there too. We are so excited to be back open. We opened up last week, May 11th. That was our soft open. And this week we started slowly with introducing dental cleanings again, and we couldn't be more excited. It just feels so good to be back. Everyone on the team's happy to be working together again. And it's like when you're making brownies and you get to lick the spoon in the bowl, you're just happy as can be. So some new safety measures we have in place. Wanted to go through these with you a little bit in detail so you know that you're very safe when you come for your dental appointment. So the first thing you'll notice when you come in is we have a barrier at both front windows, and we tried to make them as pretty as possible. So you can see at the picture at the top of the slide here is showing one of them. They turned out really well. It allows our front team not to need to wear a mask because we have that barrier. And it's hard to wear a mask when you're on the phone and trying to communicate with people through that window. So that was a great addition. And I do love to support any local business in the Chippewa Valley. So you'll hear throughout the presentation, I'll be plugging different businesses that helped us with a lot of this. And so just a thank you and a shout out to Sign Art for those sneeze shields, I call them. You'll also notice the waiting room is laid out differently. We've got the chairs separated so you can social distance appropriately, and there's hand sanitizer, and the toys and the magazines are all put away. So all of those things are looking different as well. But I think it still looks pretty warm and welcoming. We are screening all of our team members twice a day, taking temperatures, checking for any symptoms, and we are sending anybody home that has any symptoms. We have installed a UV light system into our furnace to kill any viruses circulating in the air. We are thoroughly disinfecting all the items in our treatment rooms just as much as we were before, but we've obviously reduced as much as possible off of the counters and things. And we also have barriers on our computer screens and keyboards and mice and the televisions and whatnot. And then we also have air purifiers running in each treatment room to capture any airborne particles. Each treatment room is closed off from the rest of the building during dental treatment, and other doors throughout the office are closed off as well. So this really contains those particulates and really helps keep things fresh throughout the rest of the building. We are utilizing rubber dams in the mouth and utilizing high-speed evacuation procedure, producing aerosol when we can to reduce exposure to infectious agents, and I'll go through some of that on the next slide as well. We are limiting the number of people in the office at any given time and asking for only patients to enter the building and to arrive right around their appointment time so our waiting room doesn't get too full. And then we are screening each patient when they arrive for respiratory symptoms, travel, or taking temperatures, and every patient is being asked to wash their hands and rinse their mouth before dental treatment as well. Our team is disinfecting public areas such as doorknobs, bathrooms, chair rails, all the things that people come in and touch, the pens on the credit card things, every hour or more. So we're keeping things very clean, as we always have, but even more so now. And then obviously the PPE, the masks and the shields and the gowns, your providers are going to look a little bit different, but still the same person underneath it all. It's just to protect our patients and our providers. So new gadgets. We have, some of these aren't applicable for every patient or for every procedure, but they are great for use in certain cases. So you may or may not see some of these, but we do have them. So the ADS dental suction system, which is the picture at the top right there, that will kind of sit in front of the patient's mouth and catch or contain any particulates that would be otherwise, flying around. We have the relief suction system, which our hygienists will be utilizing for certain patients, and that's at the bottom. It looks like a little leaf, and it actually sits in the mouth and suctions during the procedure, which is kind of a nice feature. We have the dry shield, which is in the middle of on the bottom row there, and that is going to be used in Dr. Martin's schedule. And so that's similar to the relief, but it's a little bit different in that it kind of blocks the tongue and some other things that allows him to keep the area dry as well when he's doing his work. But it does provide a lot of suction of the saliva to reduce aerosols in the air as well. And then on the bottom other side is our shield decals. And these are for our littlest patients because we understand that as we have all these gowns and masks and shields on, that it can be a little bit intimidating for those kids to come in. And we've procured these, and Rooney Printing helped us get these mask shield decals. So those are cute. Then the new office. So you might have heard that we are building a new office, and we are very excited. We have completely outgrown this little space on Ohm Avenue. We've loved it, and it's been great for the last 10 years, but we are just bursting at the seams. And so we've made the decision to build and to expand a little bit. We're going to still keep that quality small feel for the office, but we want to make something that's really beautiful and helps the patient experience as well. So this is where the new office will sit. We have a lot of woods, as you can see on the lot, so it's going to be really serene and beautiful. We're going to be in Altoona. It's about 3 miles from where we are now, so we tried to really stay within the same area of town so that we could still be convenient for all of the patients that come to us now. And it's right off Highway 12. So if you're heading east in Altoona toward Fall Creek on 12, it's on your left-hand side. So that's where we'll be. And you'll see, I'll show you some pictures of what's there now, because obviously it doesn't look like this quite yet. So this is the layout, and we're still tweaking things, of course, but Hoft is working with us to build the new office. We're super excited about that. They've done a great job so far, as well as River Valley Architects. So this is the interior design of the office in terms of the layout. And so you'll see we have a front vestibule, a really nice, much larger waiting room, thank goodness. And we'll have a little kids area, so that'll be wonderful. We have kind of private check-in and check-out, which will be really great and hopefully won't be so much of a bottleneck like we have now sometimes in our check-in, check-out area. And then you can see on the back of the building are all the treatment rooms, and they all face north, which faces out into that wooded area of the building or out of the lot. And so it'll be a great view for patients. And you'll see that we have quite a few more treatment rooms. So I'll kind of talk about that as we get further in here. This is just an aerial view of the roof lines, and then the top part is just looking at some different ceiling elevations and just a different softening to really make the building beautiful. This will be, well, we tweaked things since this one, but this will be partly kind of what the building looks like from the front, a nice front entrance. And this is the west entrance as well on the bottom there. This is the back of the building at the top. So you can see we have really large windows still, like we always have. And again, they'll be facing out into the wooded area. And then this is the other east elevation of the building. And these are just some more renderings to give you more of a 3D kind of a look to the building. It should be really beautiful. We're excited. So things to come. So Altoona Fire Department, this is a lot right now, actually. The picture down here, there's a house on the lot currently. And so we can't utilize the house. We need that space for the new building. And so with thanks to AKF Martial Arts Academy, who they utilize their training space for the SWAT team in town, for the fire department to do some of their training. And so we've been in touch with AKF and the owner there, and he had said, hey, maybe the fire department or the SWAT team would want to use the house before you take it down. So we've coordinated that. And so Altoona Fire Department has already started training there, and they're going to be doing a live burn where they'll take the house to the ground on May 30th. So that should be really a cool way to give back to the community and utilize that for something positive. And then we also had Habitat for Humanity come out and salvage what they could from the house, some trim, some windows, different tile and things. And so that was really great too, to know that, we're not just demolishing something. And so thank you to CCF Bank. I have a contact there that's close with Habitat for Humanity. And that's how that all came together. So our really exciting news, we have a new doctor in the works. And so we are super excited about this. That's why you saw there's quite a few more treatment rooms. Dr. Martin's schedule, as you probably know, has been very booked. And so it's hard to get in, and we want to obviously make the patient experience amazing and be able to get you in more quickly. So we're going to be adding a doctor, and probably going to be starting in late July. Our building isn't set to be done until early November. However, with all the closures and things, like all the weeks we lost in time, and that pushes everything out with the schedule, we are planning to have him start even sooner, because people need to get in. And so we're going to be all working out of this tiny little building for the foreseeable future, and it's going to be cozy, but we'll make it work. So that should be great for patients to be able to get in a little bit sooner if they'd like. And I would love to tell you who it is. I can't quite yet. He is super wonderful. We couldn't be more excited, and he's going to be a great fit for the practice. But we'll come out with that information a little bit later. And I wanted to say thank you to Prairie View Law for helping us with the contract for securing our new doctor, and dealing with all the logistical things that go into hiring an associate. And I just wanted to thank everybody for your support. And we've had so many patients call and say, thank you for doing all these things that you're doing to help, to be able to reopen and to make the dental office safe. And thank you for communicating as much as you did over the closure. And we want to thank you. Like, we appreciate all that feedback. It's so great to hear, but we also want to thank you for your continued support of our small business and our team. And we love our patients. We love what we do. And we're so happy to be back and be able to serve you. So we thank you so much. And if you have any questions, let us know. We're here. Take care.